Welcome to the Denneroll user guide video. Loss of a healthy lordosis in your lumbar spine impairs function and without correction contributes to further structural damage. The lumbar Denneroll was developed in order to improve function and help restore or maintain a healthy lumbar lordosis. The localized effect of its shape and peak is designed to give your lower back an effective stretch in the right direction in the area you need it most. There are three sizes of the lumbar Denneroll: a small, medium and large, and you would have been prescribed the most appropriate size for your needs. The lumbar Denneroll is used to improve the health of your lower back by helping restore or maintain the curve and alignment of your lumbar spine. It is designed so that when you lay over the lumbar Denneroll, your body is supported by the main surface, whilst extension happens at the peak and on this side of the Denneroll. We can use this shape and design so that when we lay onto the lumbar Denneroll, if we have the main surface pointed towards our head, we're going to target the lower lumbar spine, whereas if we turn the Denneroll around and have the main surface pointed towards our feet, then we can target the mid to upper lumbar spine. When laying onto the lumbar Denneroll, you should first lay onto the ground with your knees bent and orientate the Denneroll according to your practitioner's instruction. It is recommended a rolled towel be placed under your neck for support. You can then lift your back off the ground and gently lower yourself onto the Denneroll. Whilst doing so, position the peak as you've been instructed. From this point, the more you straighten your legs, the stronger the stretch will become. And during use, your body will essentially hang over the shape of the Denneroll, and the most effective stretch and benefit will occur to the targeted areas of your lower back. You can see in this placement, the main surface of the Denneroll is pointed toward the head, so the focus of extension is on the lower lumbar spine. Whereas if you were to turn the Denneroll around, the focus of extension will be on the mid to upper lumbar spine. And your practitioner will have prescribed the most appropriate for your needs. When trying to stretch your back on the lumbar Denneroll, it is not uncommon for you to find it quite challenging or uncomfortable, and in some cases mildly painful. If it is too challenging, an alternative can be to place a foam pad or fold a towel over the top of the product. To help with this process, there is a user guide inside the box of your Denneroll, which helps you build up the time in use in increments. In addition, this user record is available on our Denneroll app with easy-to-use start-stop or timer function and other features such as calendar sync daily reminders. Shown in the user guide, the desired time of use is 15 to 20 minutes, and some may find achieving this easier than others. Therefore, it is not imperative that you follow the user guide step by step, as the quicker you achieve this time, the better. But for those who do find it challenging, the user guide can be quite helpful in this process. When finishing your session, it is best for you to return your knees to the bent position. This will allow you to lift your back gently off the Denneroll, so you can then remove it from under you with your hands, and then gently lower yourself back onto the ground. You can then relax before getting up. When you are raising your back off the lumbar Denneroll, it is not uncommon for you to feel a feeling of weakness or vulnerability. This is not a concern, as it's an indication the ligaments in your spine have received an effective stretch. This feeling will quickly resolve once you are relaxed and laying onto the ground. If they do not resolve or other symptoms are strongly reactive, please consult with your practitioner before further use. A healthy curve in your lumbar spine provides stability for good posture, injury prevention, and reduced back pain episodes. Many lifestyle stresses place improper loading on your lumbar spine, which in turn causes muscle strain, and over time can increase the risk of injury and recurrent back pain episodes. Left unattended, an imbalance in your spine, such as a loss of lumbar curve, can lead to degenerative arthritis. These x-rays show an ideal lumbar curve and loss of a healthy lumbar lordosis. Shown in the area labelled arthritis is damage to the joints of your spine from the improper loading caused by loss of a healthy lumbar curve. A poor lumbar curve can have negative health outcomes. Over time, progressive degeneration of your lower back can impact your lifestyle in many ways. Increased back pain and episodes of sciatica are conditions associated with progressive degenerative arthritis. Over time, poor posture in your lower back can affect your mobility and debilitate your lifestyle. The Lumbar Denneroll can be used as a lifestyle tool to stretch your spine effectively into extension, which helps against the stresses of day-to-day living on your lower back in whichever area you need the most. Or it can be used to help improve function and restore better balance to your lumbar spine. Thank you for watching this video. I hope the information supports you in maintaining or getting your spine and health back in shape.